Welcome to Pipeline Health's educational series, Paragon Basics for Nursing Care Plans.
For this scenario, we are assigned Train 111. On the right-hand side, our buttons are bubbles. To review what those mean, go ahead and go to your secondary toolbar, third icon, and look for Legend. We are focused on performing a care plan, so CP means care plan, red means care plan has not been initiated, yellow means pending, and when it's green, the letter G, that means it's completed. Care plan has been initiated. Okay. So you can see it's brand new, no care plan has been added, so let's go ahead and add one. Simply left double click, go to your right hand side, select add, go to problem, click that, two ways to search, leave everything blank, and just hit retrieve. You'll get a full list of all the care plans available to you. Or you can search narrowly. So let's look for a fall care plan. Simply type it and hit enter or retrieve. And there is my care plan that's available to me. Go ahead and click select. Fill in the appropriate drop downs and filters. You can also free text additional info here. When you're done, click OK. Again, select the appropriate information, click OK, and then hit apply. Before you begin, on the left hand side, you have the patient's name, the problem, the goals and outcome, and all the associated interventions. Review the interventions that apply to your patient and initiate. When you're done, the care plan closes. Simply right click, select fully expand to review the care plan that's been initiated. When you're done, go to close. It takes you back to the main care plan screen, and your button has now changed from red to green. For this tutorial, we will review how to evaluate a goal or a problem. Let's begin. From Care Glance, select or highlight your patient. On the right-hand side, under CP, go ahead and launch Care Plan. Double-click on that button. Right-click, select Fully Expand. This way you can see all the details of the care plan, from the problem to the goal and all associated interventions. The care plan is like a tree that branches out from the problem to the goals or outcomes, and the long branches out to the interventions. To evaluate a goal, on the bottom of your screen, select Evaluate. Then go to your goal or outcome. Once you click, you'll get this pop-up and simply free text the information. In this case, this is a fall risk care plan. Let's go ahead and evaluate. Click OK, and your evaluation has been documented. You're done. Go ahead and close. For this tutorial, we will review how to inactivate a component. Let's begin. Within the CarePlan screen, select and highlight your patient. Launch the CarePlan module under CP. Simply double-click on the button or bubble. On the left-hand side, expand the CarePlan. Select Fully Expand. On the bottom, under Mode, select Inactivate. And then you can now go to the interventions or component that you would like to remove from this care plan. For training purposes, let's pretend this is the intervention or component that we would like to inactivate. Go ahead and select that. You'll get a pop-up asking you for confirmation. In this case, yes, we want to inactivate or remove this component from the care plan. Simply click on the yes button. Fill in the appropriate reason. Not applicable to patient, click OK. And you can see that there's an X icon. When you're done, go ahead and close. To review, simply double-click the button again. Right-click, fully expand, and you can see that this component has been inactivated with the appropriate timestamp. You can also scroll on the right-hand side to view all the status documentation performed for this care plan. Go ahead and close. And that concludes the inactivation portion of a care plan. Now let's review how to complete or close the care plan. This is a step that you'll perform when a patient has been discharged from your unit. Again, to launch care plan, double-click on the button or bubble. Fully expand. So right-click, fully expand. In this case, we're going to go to Mode, select Complete, go to your goal or problem. Go to your goal/outcome. Okay, and you will be prompted with this questionnaire. Fill in the appropriate filters. Did you complete this care plan? Is it a complete partial? What's the reason for it? Well, patient's being discharged. Patient remains safe. You can free text additional information here. When you're done, click OK. And the icons will now change into this yellow light, yellow hamburger sandwich icon. When you're done, go ahead and close. To review, simply launch it again, double click, and you can see the timestamp when the care plan was reviewed and closed and completed for this patient. This concludes our tutorial.